Welcome.
Thank you.
What are the current clinical challenges in esophageal squamous cell carcinoma screening and diagnosis?
Yeah, the esophageal cancer remains very high incidence worldwide, especially in China. So that's quite life-threatening. What the key point is, how we find it at the very early stage, and appropriate treatment will gain promising survival. Well, the things in the current practice, I think the majority of the patients we find was actually when they come to see doctors is at quite advanced or late stage, which means the treatment results very dismal. So the key point is still we should find the patients at a very early stage, or we remove the risk factor that may cause the esophageal cancer. And unfortunately, because the risk factors are not so clear so far. So the key point is we have to identify these patients at a very early stage. And by that, I think we tried many approaches. While so far the most reliable is still by the endoscopy with biopsy. But for the early stage, it's quite opaque. It's not so easy to it's not visualized. So far we can buy some means like biomaterial staining to help to show the abnormal area with abnormal staining. Then you take the biopsy from this area and then get the histological confirmation. Then you can to treat these patients. Well, these things I think has been done in China, because we are very high incidence countries. The result, we can show that we'll focusing on that in later on the ISDE, CSDE joint session.